Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Fibromyalgia. Introduction. Fibromyalgia is a common condition that causes pain and fatigue in the muscles, joints, ligaments, and tendons. Fibromyalgia affects about 3 to 6% of people worldwide. Fibromyalgia has a widespread range of symptoms, and its causes are not well understood. This patient education program explains fibromyalgia and how it is diagnosed and treated. Included are healthy living tips for managing fibromyalgia. Fibromyalgia. Fibromyalgia syndrome is a common and chronic disorder characterized by widespread muscle pain, fatigue, and multiple tender points. The word fibromyalgia comes from the Latin term for fibrous tissue, fibro, and the Greek ones for muscle, myo, and pain, algia. Tender points are specific places on the body, on the neck, shoulders, back, hips, and upper and lower extremities where people with fibromyalgia feel pain in response to slight pressure. Fibromyalgia can cause significant pain and fatigue, and it can interfere with a person's ability to carry on daily activities. Fibromyalgia is a chronic condition, which means it is ongoing. Even though the pain, the fatigue, and the other symptoms may get worse with time, there is no obvious damage or inflammation in the muscles or internal organs. Fibromyalgia is not fatal. Fibromyalgia is common between the ages of 35 and 55. Women are more likely to develop it than men. Symptoms. The most common symptoms of fibromyalgia are pain throughout the body and a feeling of fatigue. The muscles affected most are usually those in the shoulders, buttocks, neck, and lower back. The pain in these areas seems to originate from specific tender points. Fibromyalgia pain can be made worse by factors such as stress, weather changes, loud noises, and anxiety. Most fibromyalgia patients feel tired all the time. Many patients experience other symptoms that can be mild or severe and may come and go. These symptoms include sleep disturbances, morning stiffness, headaches, irritable bowel syndrome. Irritable bowel syndrome includes digestive problems such as difficulty swallowing, heartburn, gas, abdominal pain, diarrhea, and constipation. Painful menstrual periods, numbness or tingling of the extremities, restless leg syndrome, temperature sensitivity, cognitive and memory problems, sometimes referred to as fibro fog, a variety of other symptoms. Fibromyalgia patients may have trouble sleeping, which may add to feeling fatigued. Pain, restless leg syndrome, sleep apnea, and other sleep disorders can make it harder to sleep. Patients with fibromyalgia may feel tired despite sleeping for long periods of time. Headaches and jaw pain are common. Patients may have dry eyes or difficulty focusing on nearby objects. Many patients are very sensitive to odors, bright lights, loud noises, various foods, changes in weather, and medicines. Patients may have feelings of numbness or tingling in parts of the body, such as the legs or feet. Some patients have urinary problems, including frequent urination, a strong urge to urinate, or pain in the bladder. Women with fibromyalgia may have pelvic pain, painful menstrual periods, or painful sexual intercourse. Some patients with fibromyalgia may feel dizzy. Depression or anxiety may occur with fibromyalgia due to ongoing pain and fatigue, frustration with the condition, or a chemical imbalance in the brain.
Sponsored by the Patient Education Institute.
www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. The causes of fibromyalgia are not well understood. Healthcare providers believe there may be several causes. Fibromyalgia may be caused by chemical changes in the brain. Some researchers have found elevated levels of certain chemicals in the spinal fluid of fibromyalgia patients. Other chemicals, like serotonin, may be low in fibromyalgia patients. Researchers also believe that fibromyalgia might be caused by stress, infections, or injuries. Fibromyalgia is also commonly seen in patients who have other diseases, such as rheumatoid arthritis and lupus. Research is being conducted to try to determine if there is a genetic basis for the disease, as it tends to run in families. Diagnosis. Symptoms of fibromyalgia are similar to symptoms of other muscle, joint, and gland diseases. Fibromyalgia is diagnosed only after other diseases with similar symptoms are ruled out. First, a detailed history and thorough physical examination are done. Blood work and radiological tests, such as X-rays, may be done to make sure patients do not have a hormonal imbalance, muscle disease, nerve disease, joint disease, bone disease, infection, cancer. Electrical nerve and muscle testing known as EMG or electromyography and NCV or nerve conduction velocity may also be done to check the muscles and nerves. There are currently no diagnostic laboratory tests to confirm a diagnosis of fibromyalgia. Because there is no generally accepted objective test for fibromyalgia, some healthcare providers unfortunately may conclude a patient's pain is not real, or they may tell the patient there is little they can do. A healthcare provider familiar with fibromyalgia, however, can make a diagnosis based on a history of widespread pain lasting more than 3 months. The pain should be in at least 4 of these 5 areas: left upper region, right upper region, left lower region, right lower region, middle body region. Treatment. There is no cure for fibromyalgia. Treatment consists of managing the symptoms through medication and improving general health. Alternative medicine may also be helpful for some patients. Fibromyalgia treatment often requires a team approach with your primary healthcare provider, a physical therapist, possibly other health professionals, and most importantly, yourself, all playing an active role. It can be hard to assemble this team, and you may struggle to find the right professionals to treat you. When you do, however, the combined expertise of these various professionals can help you improve your quality of life. Following are some of the most commonly used categories of drugs for fibromyalgia. Analgesics. Analgesics are painkillers. They range from over-the-counter acetaminophen, Tylenol, to prescription medicines such as Tramadol, Ultram. Non-steroidal anti-inflammatory drugs, NSAIDs. As their name implies, non-steroidal anti-inflammatory drugs, including aspirin, ibuprofen, Advil, Motrin, and naproxen sodium, Anaprox Aleve, are used to treat inflammation. Although inflammation is not a symptom of fibromyalgia, NSAIDs also relieve pain. The drugs work by inhibiting substances in the body called prostaglandins, which play a role in pain and inflammation. These medications, some of which are available without a prescription, may help ease the muscle aches of fibromyalgia. They may also relieve menstrual cramps and the headaches often associated with fibromyalgia. However, they should be used under your physician's supervision, especially since recent data associates long-term use of non-aspirin NSAIDs with an increased risk of strokes and heart attacks. Antidepressant medications. Antidepressants correct brain and spinal cord chemical imbalances to stop pain and restore normal sleeping patterns. Doses of antidepressants for fibromyalgia are usually much smaller than what is taken for depression. Benzodiazepines help some people with fibromyalgia by relaxing tense, painful muscles and stabilizing the erratic brainwaves that can interfere with deep sleep. Benzodiazepines also can relieve the symptoms of restless leg syndrome, which is common among people with fibromyalgia. Restless leg syndrome is characterized by unpleasant sensations in the legs, as well as twitching, particularly at night. Because of the potential for addiction, healthcare providers usually prescribe benzodiazepines only for short-term use in people only who have not responded to other therapies. Benzodiazepines include clonazepam, Klonopin, and diazepam, Valium. Anti-seizure medications. Medications used to treat epilepsy may help with some types of pain. Pregabalin, Lyrica, was the first FDA-approved medication for fibromyalgia. Gabapentin, Neurontin, may also help reduce symptoms. People with fibromyalgia also may benefit from a combination of physical and occupational therapy, from learning pain management and coping techniques, and from properly balancing rest and activity. Many people with fibromyalgia also report varying degrees of success with complementary and alternative therapies, including massage, movement therapies such as Pilates and the Feldenkrais method, chiropractic treatments, acupuncture, and various herbs and dietary supplements for different fibromyalgia symptoms. If you are using or would like to try a complementary or alternative therapy, you should first speak with your healthcare provider, who may know more about the therapy's effectiveness as well as whether it is safe to try in combination with your medications. Self-care. Patients with fibromyalgia have chronic fatigue that leads to stress and sleep disturbances. Helping patients know how to live healthier lives is critical for reducing stress, improving sleep, increasing energy, and decreasing pain. Healthy living and self-care consists of a program to reduce stress, sleep well, exercise regularly, eat healthy, manage symptoms. Reduce stress. Avoid situations that cause you stress. Take time to relax. Learn relaxation techniques such as breathing exercises, guided imagery, and meditation. Sleep well. Go to bed early. Avoid caffeine, especially before going to bed. Get a comfortable mattress. Avoid alcoholic beverages. Exercise regularly. Stretch when you wake up. Low-impact aerobic exercises such as walking, swimming, and stationary bicycling can be very helpful. Exercise regularly for at least 3 half-hour sessions per week. The first few times you exercise, you may feel pain. With time, pain will become less severe. Eat healthy. Avoid caffeine, alcoholic beverages, and candy. Take vitamins under your healthcare provider's supervision or eat vitamin-enriched cereals. Eat a balanced diet. If you smoke, quit. Manage symptoms. Treat symptoms as they arise. For example, if you feel you have dry eyes, use eye drops. They are available over the counter. Massage therapy. Massage involves the practitioner moving muscles and underlying tissues mostly with his or her hands. There are various types of massage, including Swedish, deep connective tissue, and shiatsu massage. The main goals of massage therapy are to increase blood circulation, loosen sore muscles, remove toxins from muscles, align muscles and joints that are misaligned, increase the flow of nutrients. Massage helps to relieve stress and anxiety. You should avoid it if you have open sores or circulatory problems such as blood clots. Acupressure. In acupressure, the practitioner applies pressure with his or her fingers at certain points in the body. The aim of acupressure is to restore the flow of energy in invisible life force pathways under the skin. Acupressure is based on the belief that illness is caused when the flow of energy through these pathways is disrupted. Acupuncture. Acupuncture is like acupressure and based on the same beliefs. However, instead of applying pressure, The acupuncture practitioner inserts very small needles at certain points of the body to restore the flow of energy.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Fibromyalgia is a common condition that causes pain and fatigue in the muscles, joints, ligaments, and tendons. There is no cure for fibromyalgia. Treatment consists of managing the symptoms with medication and improving general health through self-care. Complementary medicine may also be helpful for some patients. Since fibromyalgia has no visible symptoms, it is often misunderstood. Helping patients and their friends understand the condition makes coping easier. Stress management techniques, exercises, and medications help fibromyalgia patients cope with pain. Thank you for using Explain.